55 critical access hospitals. That's still fewer than one per county in the 3rd District of Nebraska, but the beauty of the system is even though there's a singular designation, there's no two alike in terms of what they do or how they meet the community needs. And so I hope that we can work together on regulatory relief. I know that your department has been working on that. I appreciate the administration's commitment to that, including making the 96-hour enforcement a low priority for contractors. And like I said, look forward to working with you on that. Now, I do want to touch briefly. Last year when we had this hearing, I submitted a question for the record relating to the Bay State boondoggle. Did not receive a response. So could we, I guess, work to get more information on the Bay State boondoggle in that reimbursement formula that I think is clearly broken and really takes resources away from hospitals in so many states across the country?
I'm not familiar with the issue, but I will ensure that we get you a response on that. I'm sorry you haven't heard back yet.
Sure, appreciate that. Another issue that I hear a lot about recently is the deeming of competitively bid prices for durable medical equipment in non-metropolitan areas, and particularly whether the deemed reimbursement levels are sustainable for providing appropriate service in rural and remote areas. And can you tell me whether CMS compared these reimbursements to the cost of actual delivery of DME in rural areas when making this decision? And wondered if you might be able to, maybe not today, but to get information for me later on.
So I am very concerned about ensuring that our competitive durable medical equipment program works well, especially in rural areas. In the budget proposal, actually, we have ideas there around how to make that work better for rurals to ensure that rurals are competed and the pricing in the rural area is based on the rural providers, and also the bid that the winner gets is their bid, not just a median price. So I'd love to work with you. We want to make this work for rural providers and rural citizens.
All right, I appreciate that. One more topic is the MIECHV program, the Maternal, Infant, and Early Childhood Home Visiting Program. Very successful program, has bipartisan support, and part of it is because of the benchmarks that are used that can be chosen to focus on improvements on family economic self-sufficiency. And the previous administration decided to define economic self-sufficiency as being in school or having health insurance, and not really looking at the employment and wages. And so I was wondering if you might be willing to work with us as we do try to accurately reflect self-sufficiency. Thank you. I yield back.
Thank you. Mr. Thompson, you recognize.